911 calls. In this course, we'll talk about how to handle 911 calls. All 911 calls are treated as an emergency with a unique and urgent manner until proved otherwise. That means that this is an exception when there is no need to do a pre-session, collect the client's information, and do a full script introduction. It needs to be short and swift. Please remember that it could be a life and death situation. This is how 911 calls are handled.
Police, fire, and medical. Okay, what's going on?
It looks like an ordinary office building, desks with monitors, busy workers answering endless calls.
Oh, well, I mean, everything really happens in seconds.
This dispatch center in Omaha, Nebraska is pretty typical of those around the nation.
About 200 each of us. The most has been like 260, 270 calls per person.
Kristen Avant is a 911 operator, the first person callers hear. The callers usually need help from firefighters, medical assistants, or police.
A simple emergency where it can be done in 30 seconds to a minute. All that information is obtained, and as soon as the operator is talking, they're typing. As soon as they're typing, the dispatcher can already read that information. So calls can go very fast.
Operators stay on the line while dispatchers get in touch with a fire brigade or ambulance.
The call is going to be presented on a computer screen, and the first thing that I need to do is find which officers I have available, and based on the way that they're assigned to their geographical area, which officers would be the closest to respond to a situation.
Sometimes police are needed, and operators keep talking to the caller until officers arrive.
If there's a burglary in progress, like someone's breaking into their house and they're in the house, like you try and keep them on the phone so you can direct them when the police get there so they know what the officers want them to do.
It can be a stressful and emotionally draining job, particularly if help does not arrive in time.
Car got rear-ended, like on a highway somewhere, I can't remember where exactly, and by a big truck. And the car started on fire, and it was two people trapped inside. They couldn't get out because of the way the car was impacted from the truck, and you could just hear them screaming on the open line.
Psychological help is available when operators need it. Operators say the job is tough but rewarding.
Now that's something that I could do, the challenge of it, but the reward at the end.
Operators and dispatchers work 8-hour shifts to make sure they cover all day and all night, because they say emergencies are never welcome and never predictable.
When a 911 dispatcher answers a call, they follow the emergency, fire, and medical dispatch protocol system. Each protocol is carefully standardized, containing consistently partitioned information, which separates sections for key questions, response codes, dispatch determinants, additional information, post-dispatch instructions. This is what 911 calls sound like.
Austin 911, do you need police, fire department, EMS, or mental health services?
At 7100 North I-35, the Denny's.
Okay, what's going on?
We just heard shots going off in the back.
Okay, how many shots did you hear?
My said it was a couple, and somebody told her that a guy that was walking past our building was overshooting and shot somebody.
Okay, stay on the line for EMS.
All right.
Ambulance, what's the address?
Okay. Did you find them? No.
Is this the ambulance? What is the address of the emergency?
It's going to be 7100 North I-35.
Oh, is it the dentist?
Yes, ma'am.
Okay, and what is the phone number you're calling from?
The phone number here? Shoot, I don't even have the number.
Oh,
but you can call me at... Huh?
Yeah, if you don't know it, it's okay. If we get disconnected, call me back at 911. What is your name? Okay, tell me exactly what happened.
We were just informed, because I have... one of the homeless guys came up and let her know that there was a guy that was shot, and the guy that was shooting was walking past our store, and then there was more shots fired in the back.
Okay, and was anyone hit? Was anyone injured?
We were told there was a guy shot. I can't see him because we put a lockdown on us.
Okay. And I have a few more questions for you, okay?
Yes, fine.
Answer these questions. And who was the person that told you that someone was shot?
It was a guy named, he walks around here all the time.
And were they able to see who the person was?
I don't know. Won't let none of us out the building.
Okay. And like I said, I know you might not be able to see where that person is to do your best to answer these questions. Are you with the patient now?
No.
Okay. How old were they?
I do not even know. A lot of them over there are probably in their 20s.
And I just want to confirm, are they a male or a female?
I was told it was a male.
And were they awake?
I do not know, ma'am.
And are they breathing?
As far as I know, I do not have no clue, ma'am.
Okay.
I really don't.
Yeah, I understand. I'm going to keep asking you some questions, okay?
Oh, you're fine.
Going to answer these. And when did this happen?
It happened over by the 7-Eleven.
No, when?
Oh, just a few minutes ago, like 5 or 10 minutes ago.
Okay. Do we know if the assailant is still nearby?
He was in the back of the Motel 6. He's all white pants on.
Okay.
I don't know.
I can't find my key.
Yeah, can you give your key?
The whole key ring.
I have, actually. No, I got.
And I'm sorry, behind what store?
Behind. He's all in all white pants, as far as what I see.
Behind what store? Behind
the Denny's.
Okay.
He was like going to the Motel 6 parking lot.
Okay. And is there any serious bleeding?
No, I do not know.
Okay. And do we know what part of the body was injured?
No.
Okay. Okay. I know that you're in lockdown, but if you do have more information or you come in contact with the person that was shot, go ahead and give us a call back. But stay on the line with PD, okay? They might have more questions for you.
Okay.
Okay, ma'am, the suspect is black, white, Hispanic, or Asian?
He's black.
Okay. Do we know what the weapon looks like?
No, I did not see it, but I went out back and the guy was still firing shots.
Okay, is the with you? Are you able to ask him?
No, she just went outside. She's
Okay. Do you see any officers there, ma'am?
I'm in my office. I cannot see.
Okay. EMS, go ahead if you have any questions. Okay, well, we have officers that should be arriving right now, and we're also going to get EMS out there to look for the patient. And I'm sorry, let me get your first name one more time. Okay. They should be pulling up just in a little bit, but if anything changes, call us back immediately. Let us know what's going on.
Okay, thank you.
Okay, thank you.
Handling 911 calls. You should be prepared to move swiftly to assist. Remember, it is permitted to paraphrase if needed. Depending on the scenario, you might need to describe vehicles, people, clothes, surroundings, symptoms. After you hear, "This is a 911 call," or "911, what is your emergency?" you will know to skip the scripts and go right into, "Hello, I'm going to be your interpreter. How may I assist you?" You will then usually hear the dispatcher say, 911, what is your emergency? Again, this would be an exception of a session where you do not go through the regular protocol. Your target is to help the operator or EMT to collect all the necessary information in a fast and accurate manner. Depending on an answer, police, fire, medical, a set of questions will be asked. Here are some examples. In case of fire, the following questions will be asked. What is the address of the emergency? What is the telephone number you're calling from? What is your name? Tell me exactly what happened. Do you see any flames? If no, do you see or smell any smoke? Are you safe and out of danger? Can you get to safety? Yes or no? You will be provided with pre-arrival instructions as to what to do until the fire department arrives on the scene. Exactly where are you located? Is everyone else safe and out of danger? If the answer is yes, you will be provided with pre-arrival instructions as to what to do until the fire department arrives on the scene. Can I get to safety? Depending on yes or no, you will be provided pre-arrival instructions as to what to do until the fire department arrives on the scene. How many exactly? Where are they located? The above questions are critical information that can assist expediting the responding field units. Questions 1 and 2 are crucial in order to send and verify the nature of the emergency. The rest of the questions are asked based on the information provided in questions 4, which is, tell me exactly what happened. If this is a medical emergency, these questions are usually asked. What is the address of the emergency? What is the telephone number you're calling from? What is the problem? Tell me exactly what happened. Are you with the patient now? How many other people are hurt or sick? This question is asked when reporting traffic or transportation accident with multiple victims. If a choking patient, are they choking now? You need to go check and tell me what you find. How old are they? If unsure, you will be asked to tell how old they are approximately. Are they conscious? Depending on yes or no, you will be provided with the pre-arrival emergency medical dispatch instructions via the telephone until rescue arrives on the scene. Here's some sample scenarios for the emergency department to help you be prepared for such sessions. Shortness of breath. In case of asthma exacerbation, COPD, or patient stops breathing. The patient might already be intubated. In this case, the interpreter might be needed to interpret for the family. The patient will usually be put on oxygen and given a breathing treatment. The patient may be given a nasal cannula or be placed on CPAP. The interpreter may have difficulty hearing the patient because the patient will probably have on a breathing mask. The provider may ask if the patient has a living will or advance directives. If the patient is intubated, they will be transferred to the ICU. The doctor may explain the following. The patient's oxygen saturation is not what it is supposed to be. It needs to be over 90%. The steps regarding treatment for shortness of breath are oxygen, a nasal cannula, CPAP, intubation, and placement on a ventilator or breathing machine. Here's the protocol in case a stroke is suspected. In a rule-out stroke, TIA, or ischemic infarct, the following commands will be given to the patient. Raise your eyebrows, smile, puff out your cheeks, squeeze my hands hard. I'm going to touch different sides of your body. Let me know if you can feel what I do. Press down with your feet against my hands. Pull up your toes toward your head. Lift your right or left arm and leg. IV will be placed. The patient will then be rushed off to CAT scan. Basic triage questions will be asked. The neurosurgeon will do a cognitive evaluation. It is compulsory that the interpreter interprets verbatim, word by word, during these situations, even if it sounds strange. The interpreter must not add or subtract to anything what was said. This is the part of the cognitive evaluation. The patient will be continuously asked, what is your name? What is the date today? Do you know where you are? What year is it?
Hello, welcome to Stroke Code Training for Interpreters. I'm Dr. Pankaj. I'm a neurologist and also an immigrant who understands how communication barriers can create gaps in medical care. A few years ago, I noticed that we could improve communication during stroke codes when a patient who is not fluent in English presents with acute stroke. Since the treatment is time-sensitive and delays may lead to worse disability, my colleagues and I want to partner with you, the interpreters, to improve outcomes. This module will prepare you to help us during a stroke code, particularly by familiarizing yourself with the NIH stroke scale. So what is a stroke code, and NIH stroke scale? A stroke is an emergency that occurs when a blood vessel that carries blood to or from the brain is either blocked by clots or bursts. When that happens, a part of the brain cannot get the blood and oxygen it needs, so the brain cells in that area die and the patient experiences symptoms like arm or leg weakness, loss of vision, speech difficulty, decreased sensation, loss of balance, dizziness, etc. 2 million brain cells die every minute until the blood flow is restored. Therefore, time is brain. So, an emergency pathway called stroke code is activated so that the medical team can quickly examine the patient and get them into the CT scanner within minutes of activating the code to help make time-sensitive treatment decisions. There are 2 types of urgent treatments offered to patients with a stroke due to a clot, TPA and thrombectomy. TPA is an IV medication that can break up the blood clot and allow blood flow again through the affected artery. Currently, this can only be given within a time window of 4.5 hours of symptom onset, or if the symptom onset was unwitnessed, then 4.5 hours from when the patient was last known to be well. The faster the TPA is given, the lesser the disability after stroke. The other intervention is thrombectomy. A catheter inserted into an artery in the leg is threaded up to the blocked artery in the brain and the clot is removed, which restores the blood flow. Currently, this can be done within a time window of 24 hours from symptom onset or from when a patient was last known to be completely well. Now that you understand the time-sensitive nature of stroke codes, let's focus on the crucial role that interpreters play in the first few minutes of a stroke code with the NIH Stroke Scale, or the National Institute of Health Stroke Scale. It's a questionnaire that helps us in understanding the extent of disability and to localize the part of the brain that is having a stroke. The key is to finish going through the list of questions as quickly as possible. If the patient does not respond to certain questions or commands, painful stimulus might be given by the provider to assess for level of consciousness or any evidence of movement. Do not repeat the questions unless the provider indicates so. Question 1A. Level of consciousness. To assess responsiveness, patient is greeted with, "Hello, how are you? What brings you in today?" Question 1B. Level of consciousness questions. 2 questions are asked. A. What is the month? B. How old are you? Question 1C. Level of consciousness commands. Patient is asked to follow 2 commands. A. Open your eyes. Now close your eyes. B. Make a fist. Now let it go.
The patient is first asked to open and close her eyes. She's then asked to open and close her hand.
Question 2. Best gaze. Patient is asked to follow the provider's finger with their eyes.
The patient is given a target to follow so that we can examine the full range of horizontal gaze.
Question 3. Visual field. Patient is assessed for visual loss by asking the patient to look straight ahead at the examiner while showing different number of fingers or movement in the 4 quadrants of their visual field. The patient must point to the movement or tell the number of fingers.
The patient is asked to look at the examiner's nose and is given stimuli in each of the 4 quadrants of the visual fields.
Facial weakness. To assess for weakness in face muscles, ask the patient to smile showing their teeth and next to close their eyes tightly. Question 5A. Motor strength. Arm right. Question 5B. Motor strength arm left. Patient is asked to keep their arm up for a count of 10 seconds.
With the patient in the hospital bed, the arm is placed at approximately 45 degrees with the palm down and the patient is instructed to hold the arm still for 10 seconds.
Question 6A, motor strength leg right. Question 6B, motor strength leg left. Patient is asked to keep their leg up for a count of 5 seconds.
The leg is placed at a 45-degree angle, and the patient is asked to hold the leg still for 5 seconds.
Question 7, limb ataxia. This looks for coordination in movements through 2 tasks. A, finger-nose-finger test. The patient is asked to touch their nose with their index finger and then touch the examiner's finger and go back and forth. This is repeated with the other hand too. B, heel-to-shin test. Here, patient is asked to take the heel of one leg and place it on the knee of the other leg and then slide over the shin. This is repeated on the other side.
Take your finger here and touch my finger. Now touch your nose. Now my finger, now your nose. Now my finger, now your nose. Good. Now on the other side, I don't know what we'll be able to do, but see if you can lift it and touch my finger.
I can't.
Can't get up that high. Okay. Let's see what happens with the legs. All right?
Okay.
I'm going to take your right leg. I want you to put your heel on your knee and run it down your shin. Let's see what happens. Can you bend the knee? Put your heel right there. And run it all the way down your shin. And back up again. That's great. Now relax. Now let me try the right leg. I'll lift it up, and you put the heel on your knee and slide it all the way down. And can you slide it back up?
I can't do
Okay, put it down and slide it down one last time. Very good.
Okay.
Question 8, sensory exam. Here, we assess for decrease in pain sensation to one half of the body compared to the other half.
0.
I'm just going to see if you can feel this, okay? I'm sorry for the pinch. Do you feel that? Okay. How about over here? Do you feel this here? You feel that? Okay.
This time there was a normal response on the left side, but an abnormal response on the right. So the item is scored 1.
Give you a little pinch to see if you can feel me. Do you feel that there? Sorry about the pinch. Okay. And how about over here? Do you feel that here? How about here? Do you feel anything here? Okay.
In this example, no responses were observed. This is also abnormal, so again the item is scored 1.
Question 9, aphasia or speech difficulty. We ask the patient to name or describe the contents of 2 pictures. Please make yourself familiar with the content of these pictures. One picture has a glove, key, cactus, feather, chair, and hammock. The second picture shows a boy falling off of a stool while trying to get a cookie from the cookie jar. A girl is standing below and asking for a cookie. A lady is cleaning dishes while the sink is overflowing. Question 10, dysarthria. Speech clarity is tested here. Is it clear, slurred, or difficult to understand? By asking to repeat or read a set of words. Since the typical words on the stroke card are difficult for non-English speakers to repeat, here we will use more internationally used English words. The list of words we will ask the patient to repeat one by one are taxi, mama, coffee, dollar, doctor, passport. Also, pay attention to patient's speech clarity and help the provider with your best judgment on the same. Question 11, inattention. To assess for neglect of one side of their body or visual field, patient is simultaneously touched on both sides or simultaneously provided visual cues to both eyes.
Moving now, and now. How about now?
Visual stimuli are first presented to the 2 sides separately and then to both sides simultaneously.
What am I touching now? And now? And now.
The same technique is then applied using touch with the patient's eyes closed.
So, this is the NIH stroke scale in a nutshell. Familiarizing yourself with these questions and understanding the urgency of a stroke code is key to this training. If we can prove that interpreter education decreases time to treatment initiation, we can advocate for the same in other institutions across the country. Thank you for being a part of this journey to make a difference.
This is the protocol for vaginal bleed to rule out ectopic pregnancy or miscarriage. Common triage questions will be asked. Other common questions and commands are: Are you pregnant? We are going to get a urine specimen to see if you are pregnant. How long has the bleeding been going on? How many pads are you using in a 1-hour period? Is the blood bright red, brown like coffee grinds, or black? Is the blood like spotting, streaks, or wetting the pad? Are you bleeding from the vagina or from the rectum? The patient will get a pelvic exam. The patient will be placed on a pelvic gurney, or a bedpan will be set under the patient's buttocks. The patient will be asked to scoot down to the edge of the bed. The nurse will set a pelvic cart, which includes speculum, lube, swabs, a powerful light. The physician usually says, "You are going to feel me place my hand on your leg. I will then check the outside of the vagina. I will now insert the speculum. You will feel the pressure and cold from the gel. The doctor will then palpate walls of the vagina to check for tenderness." The patient may be asked when the last time was she had sexual relations. The patient will get an ultrasound. This will be the abdominal and transvaginal. The ultrasound technician will request that the patient insert the probe into her vagina, and then the technician will take over. The patient may be screened for domestic violence issues. The patient may be asked if she feels safe at home and has been kicked or punched in the stomach. In the event of ectopic pregnancy, the patient may have to have surgery. The doctor will explain that the pregnancy is in the wrong place, not in the uterus, and that the pregnancy needs to be removed, or the mother risks bleeding to death. The surgeons will consent the mother for surgery and consent for blood products. Here is the protocol in case of a chest pain to rule out a heart attack. Are you having any chest pain? Do you feel short of breath? SOB. How many blocks can you walk before you feel short of breath? Does the chest pain radiate into your back, jaw, arm, or anywhere in your body? Describe the pain. Is it sharp, dull, burning, or does it feel like pressure? Do you or does anyone in your family have a history of heart problems? Do you have high cholesterol? I'm going to give you an EKG. I'm going to place stickers on your shoulders, lower legs, 2 on your chest on each side, and others around the left side of your chest. I am going to get a tracing of your heart. Do not move. I'm going to place an IV in order to get blood samples and administer medication if necessary. I am going to get some blood work to rule out whether or not you have had a heart attack. I'm going to check your cardiac enzymes. We are going to get an echocardiogram. We need to go to the cardiac cath lab and do an angiogram. We may need to place a stent in the event of an obstruction or stenosis. We may also just use a balloon to open the obstruction or stenosis. This is the protocol in case it's a level 1 and level 2 trauma. It is important that the interpreters say exactly what the patient says verbatim. During a trauma situation, some patients may suffer a closed head injury and are cognitively not functioning correctly. The patient could have a brain bleed, a concussion, or some other head issue which affects the patient's cognitive skills. During a trauma, the patient will be first evaluated by the physicians, anesthesiologists, physician assistant, and trauma nurses. The nurses or paramedics will usually put in either 1 or 2 IVs. The doctor will perform a neurological examination. The patient is asked to squeeze my fingers, push against my hands, pull me towards you, press down on my hand with your foot, follow my finger with your eyes without moving your head, rub your right heel up and down your left shin, and vice versa. The patient will probably get a bedside x-ray. The patient will probably get a Foley catheter and a rectal exam. The patient will then most likely go to CAT scan, and ultrasound may be called to the room. If the trauma requires surgery, the surgeons will want to speak to either the patient or family members, get a consent form signed for the pending procedure. Here are the questions asked for car accidents. Did you have on your seatbelt and lap belt? Did the airbags deploy? How were you hit? T-bone, sideswipe, head-on, rear-ended? Did you lose consciousness? Did you get out of the car and wander around the scene? Were you the driver? Where were you seated in the car? Some other questions could be asked. Are you having any numbness or tingling? For visual acuity, blurry vision, spots, double vision. Do your teeth line up after biting? Are you currently taking any medications? Blood thinners, medication for high blood pressure, diabetes, antibiotics, etc. Do you have any past medical conditions such as heart problems, kidney problems, lung problems, asthma, diabetes, high blood pressure, cancer, or blood disorders? Have you had any past surgeries? Appendectomy, cholecystectomy, heart surgery, C-sections, broken bones, etc. For females, are you pregnant? When was the first day of your last period? If you need blood or blood products, would you accept them in a life-threatening situation? Here are the questions asked in case of a sexual assault. Have you been sick in the last few days? Do you have any stomach issues going on, such as diarrhea or constipation, nausea or vomiting? Have you had any rashes? When is the last time you had a bowel movement? For females, when was the first day of your last menstrual period? Had you had any pain or burning upon urination before the incident? When was the last time you ate or drank anything? Do you have any past medical conditions like heart, lung, kidney, or liver problems? Do you have diabetes or high blood pressure? Have you had any unexplained falls in the last 3 months? Have you had any surgeries? Have you ever been diagnosed with MRSA or VRE? Thank you for completing the course on how to handle the emergency on 911 calls and situations.